Wait. You tell me when.
Okay. Here, let me record this. Okay. You wanna I have to have permission to record.
Oh.
Now I made you the host.
Oh no. Okay. Here we go. Okay. Does that work?
Oh my gosh. It says this recording will be saved to a disk that has less than 1 gigabytes available. Is it because my computer is full? That's never happened before.
Oh, really? I don't know. If you want, I can. Sorry, I can also.
Oh, okay. I just deleted like a bunch out of my recycle bin.
Okay. I was gonna say we can both record, and if one of them like fails,
yep.
And if you want to do that too, we can do that.
Yeah, let's just do that because I've had so many technology problems during the team. I know, like Aaron's internet went down for like an hour in between. I know, and then it went down again at the end, and we're like, just forget it.
Oh no!
I know. It was bad, but yeah, I mean, we learn these things now, and now we can better them and learn from them when we can use them.
Tyler recommended at the very beginning of internship that I get an Ethernet cord that connects my computer to the router.
Yeah.
And I wish we would have done that at the beginning because I still have not done it.
Well, my internet, thank God, like I don't want to jinx it, is so good. I've never had issues with mine, but she's like at her mom's and she's like, so it's not her fault at all. I'm just,
it's different.
The first time it recorded weird, so whatever. Okay, let me see. Okay, so now it's recording. But so I was just gonna ask you a few questions before we started.
Yeah.
So I put like 2013 that we'd switch because it's like right after a question and 20 minutes.
Okay.
So I can.
Go ahead.
Do you want me to? Because I know we talked about a couple different ways. Like I can go off camera and then I can come on when it's time to switch. So but for feeding and stuff. So how do you want to be fed and stuff? Because I guess that depends.
So I watched the majority of my part, and it's pretty much like question answer. So it's pretty much like there's not like a lot of numbers and whatnot, which is good. Mm-hmm. So if you want to stay on the screen, you definitely can. I mean, when we first were chatting, I really didn't view it yet, so it was kind of hard to say. Plus, there's not a consumer, so with us being here, it's not obtrusive to like their view, because sometimes it can be distracting. Yeah. But if you want to stay on screen, that's cool. When it's time to switch, I will maybe. Is there a way that I can keep this bar up? Like if I have or does it always like go away?
I think it goes away unless you click move on it again. But so it's after the question about like making things like you'd be ending the sentence like making things simple for older adults because they need to keep safe and like your parents. You remember that question is like right at the end, like right at like 20 minutes. It's just,
okay. Yeah, and then she wraps it up.
Yeah, and then mine starts with that like really long name. Like the worst one.
I can keep the closed captions. Wow, I can keep the closed captions on if that will help you.
That's okay. That's like the hardest one, and I've memorized that one.
Okay.
So it starts at Nala Abu Muhammad. That's like where I would start that question. So your last answer would be about older people and keeping them safe and making it simple, like with images and stuff. Do you remember that one?
Yeah. Cool.
And then, I mean, I would like to use this for portfolio, possibly. So what do you think would be better that I stay on camera just so like we can pretend to feed each other if we need it? So it's more like a teaming one.
Yeah.
And then I'll just do switch just because you're interpreting, but we know like the timestamp and stuff. And then I mean, if I like miss something that's salient, go ahead and like jump in and feed that in and like finish that sentence, and then I'll jump back in.
Okay. you want any feeds in the chat?
Yeah, I've never tried that, so I'm up for trying that. It's hard because, well, I guess you can incorporate it later. Like if I miss something and then I see the chat, and then I can always incorporate it later if I have the opportunity. So yeah, let's do that because I've never had that experience.
Okay, I'm just gonna send you a chat message now so you can have it on your screen or whatever so you see it.
Yeah, so just keep that up.
Yeah.
That's such a good idea. Okay, let me just make it smaller.
Okay.
So where do you usually put that? So like
it depends. For this one, there's nobody signing. So I'm just gonna keep it kind of where my bubbles are for you and I. So like when I share the screen as the screen share, the videos go up right at the top corner.
Yeah.
So my chat's just gonna be right near the videos, so then I can like see you and then see the chat at the same time. But I know my view is different.
I know, because mine's like really big, but I can keep it down there. I think it'll be just easier. I'll be able to see. So it doesn't make it like, let me make it very small. Oh wait, I moved us to bigger.
Oh, okay.
But it's still like, let me see. Sorry.
No, you're fine.
This is a good idea though, because it's a good practice.
Can I try something really quick while you're figuring that out?
Yeah.
Okay, hold on. Nope. Okay, I was just wondering if that was going to work.
Mm-hmm.
It did not.
Okay, I think I'm just gonna put the chat box. I can notice when it comes up.
Okay.
And if it doesn't, like, I'm trying to think. If you're moving, I'll be able to notice if you're trying to signal something, and I can look down there. But
Okay.
I'm usually observant when like seeing that like lights up red or whatever. And then last one, I was going to ask you how you so it's consistent, because I think they talk about stigma a lot, and like I know it's like a feeling that's negative, or like I know what it is, but I didn't know the best way to, or how you were. Does that come up in your part or no?
It does. So what I was thinking of doing was something like a stereotype. So I've seen stereotypes as like this, but that negative stereotype. If you want to do that for stigma, negative negative label.
Yeah.
Or is that
Yeah, I had that down too, because I looked it up, and that was like one of them that made sense, like a negative, because it's like a negative feeling that everyone's putting, like, we just say like negative feeling or label. I think they both, work.
You can always, if you really wanted to get fancy, you could always do like judge too, like you're looking down at somebody.
Yeah. Yeah, I think it's like when everybody's negative about coronavirus, like it's so bad and da da da, like that's like the stigma, like negative feeling, yeah.
Yeah.
Because it comes up a lot in my part, so I don't know if I should spell it every time so it's clear, but obviously I'll spell it the first time, and then I might just use like negative feeling or label.
Yeah, mine comes up when it talks about mental health. So when she talks about like there's a negative stigma on mental health. So with coronavirus, it's a little different because it's not like an actual person. So gotcha. Okay. Yeah, I think that works. And honestly, like try out different things, like, feel it out.
Yeah.
Do whatever you think is going to be successful, and then you can reflect on it and be like, okay, I realize this wasn't effective, but when I tried this, it was very effective.
Yeah.
Yeah.
Yeah, that sounds good. And then for the countries, it's funny because I looked up all of them, but it was fun because Madison and I did it together. But I'm just gonna 1, 2, 3, 4. I'm just gonna sign 5 of them, and then just do like that, like total 24, and like just put like many different countries. Like that was the goal.
So. Yeah. I asked my mentor, and she said she would do like she would sign a few, and then she would say like all over the world and whatever. Thank you for coming. But she was like, I would probably sign a few. I don't think I would admit all of them, but I would probably do a few. And I was like, cool, thanks.
Yep.
Okay.
Okay.
All right. Well, you tell me when we're ready to go.
Okay, I'm gonna mute, and then if I for some reason, I should be able to stay on mute. So.
Okay.
But yeah, I'm ready when you are.
Okay. Oh, really quick. Let me know if you need me to pause it too.
Okay.
Because I have worked with another team before, and I felt really bad because I kept feeling like they wanted to pause it during their interpretation, but we didn't establish that before. So I was like, I can't tell if you want it or not. So if you do want to pause it, you can sign pause or pause or.
Yeah, I'll just be like pause.
Okay.
Yeah.
Cool. Sweet. All right. I'm going to go ahead and play it.
Hi, good afternoon, good morning, and good evening. Thank you for joining our live today from WHO headquarters in Geneva, Switzerland. We are live today on Facebook, LinkedIn, and Twitter. And we're going to talk about coronavirus or the COVID-19, as you have heard in the news a lot. So the disease have affected people from many countries, and in January 2020, WHO have declared as a public health of emergency. And for this outbreak, we know that we are not only fighting the virus, but we are also managing stigma, fear, and discrimination. So today, I'm sitting here with our mental health expert, Aisha Malik, to talk about why is it important to talk to understand about the mental health aspect on this disease. So Aisha, can you explain to our audience today why is it important to understand about the mental health on COVID-19?
Thanks, Sari. So, as Sari said, we're not just talking about an outbreak of COVID-19. What we're also seeing is an increase in the anxiety that people are experiencing. So it's really important to think about mental health as part of the public health response to COVID-19. We know that in emergency situations that mental health can decline in the population and that there's a higher rate of mental health conditions. So people who might be vulnerable to experiencing mental health or stress during this time might include people who have pre-existing mental health conditions or substance use conditions in the community, or who might represent other vulnerable groups who are vulnerable to stress. So we're not just talking about protection from COVID-19, but we're also talking about prevention of stress and fear during this event as well.
Thank you, Aisha. And if you have any questions for Aisha around the mental health on COVID-19, the new coronavirus, send in your question as comment on Facebook and LinkedIn. And on Twitter, you can tweet and use hashtag AskWHO. So Aisha, there's a lot of fear spreading right now around the new coronavirus. Should we actually be scared? Or is it the result of the spread of misinformation that people see in social media and the news? Can you tell us more about that?
Sure. So fear is a response to perceived or actual threat or danger. And closely linked to that is anxiety or worry or stress, which can come about when things are uncertain or unknown or unclear to us. And as COVID-19 is a new virus, and as we are still learning very much about this, although tremendous work has already taken place already to learn about the virus, it naturally can elicit these types of feelings. So you will hear this message repeated quite a lot, but it's really important to bear in mind that fear and anxiety is part of the normal response to this new situation. So many things can cause fear, and one of those things is misinformation, and rumors. So this is something that can exacerbate people's fear. And it's why a repeated message for managing fear in the COVID-19 response is to get facts. So facts minimize fear. And these facts can be obtained from credible sources or trusted scientific sources, for example, WHO or your national or local public health body as well. In terms of fear, many of you might not think that you're experiencing fear or worry, or some of you might be thinking that way. It can express itself in various different ways. So you might be experiencing a high level of questions that you're asking yourself, or a high number of thoughts that you're having. So questions like, how do I protect myself? How do I protect others? What's going to happen with my workplace? These are all very natural questions to be asking. And if you're asking these questions, then I would again encourage you to go find the facts and get the answers as well. So fear is something that's designed to keep us safe. So it makes us take action to keep ourselves safe. But sometimes the actions that we take might be inadvertently harmful to ourselves or to others. So this can include things like stigma. This can include panic-like behaviors. It can include things like overwatching distressing sources of information. So sometimes fear can be both helpful and keep us safe, but also could be harmful as well. And so it's important for us to think about how do we manage that fear.
Thank you, Aisha. And there's a lot of information on our website. You can go to www.who.int/COVID-19. I repeat, www.who.int/COVID-19. Aisha, other than fear, there's also a lot of discrimination and stigma, particularly affecting the Chinese population because the outbreak started in China. Can you explain why this is happening and what is the solution?
Okay. So stigma or health-related stigma is something that can arise where a sense of disapproval or shame is attributed to a person because of their association with a health condition. So here we're talking about COVID. And what that does is it can result in the experiences of rejection or exclusion or acts of discrimination. And these acts of discrimination can be very harmful physically and mentally for that group. So our main message here is around the use of language to fight stigma. So words are very powerful. Words can create stigma, but that also means that words and the words that we choose to use can minimize stigma as well. So for example, one thing that we would encourage is not to attribute COVID-19 to any specific socio-demographic. So that can include, for example, ethnicity or nationality or geography. COVID-19 can and has affected people from various different backgrounds. It's a global issue, and it's important to not attach it to a particular identity group because it can affect acts of discrimination towards that group or people who might be perceived as belonging to that group. So language also can go beyond that as well. So we can also think about how do we use language when we talk about COVID-19. One of the things that we can do is something called separating COVID-19 from the person that you're describing, rather than giving them the identity by COVID-19. So in English, what I mean by this is you would prefer to say a person has COVID-19 or a person who is recovering from COVID-19, rather than attaching the label to the person. For example, a COVID-19 case, a COVID-19 family. Other examples of how we can think sensitively about our language in order to minimize stigma is to not use terms such as victims or suspected cases. These are words that can arise anxiety, and so it's better to use alternative phrasing. So keeping your language as person-centered as possible. And another important way to address stigma and discrimination is to really think about messages which evoke empathy, messages which invoke compassion and which evoke kindness. So one way that this could be achieved is to start sharing stories which are around hope or positive messages like recovery. So stories about recovery or stories about loved ones supporting a person who is unwell during that time, or about communities supporting each other. So we've heard in press briefings this week some very nice stories coming from communities who have been supporting family members of health workers who are responding to COVID-19. And on top of these actions that are constructive that you can do, the community and the public play a huge role in tackling stigma and discrimination. So you can yourselves be advocates for using these kinds of language tips that we've given, and also for addressing any misconceptions or rumors or misinformation that's been spreading. So I would encourage everyone to take a role in that. This is something we can all participate in. And we also have guidance available on the WHO website, which will give you some tips on the kinds of things that you can do to tackle stigma.
Okay. So we all have a role.
Yes.
Aisha. Okay, so we actually started getting questions from the audience. Thank you for sending your questions. And I will be checking my phone every now and then, and apologize for that because I need to read the questions. So Aisha, the first question is from Vasuki Vasudevan. It's a good question. As parents, how do we cope with this stress following the news and all that about the coronavirus? And how to talk with children about this COVID-19?
It's a really good question. It's a very important thing to be thinking about in terms of mental health considerations when we think about the stress that young people might be experiencing, and in turn, the role that parents might have as part of alleviating that stress. So during a situation like this, and it very much depends on the situation in your own community, children will experience stress, children can experience stress, and they might present in many different ways. They could be more attached to you or more clingy to you. They could be sad or crying or withdrawn, or even to the point of bedwetting if they're very anxious. So children express stress in different ways. And what we encourage is for parents to give as much love and attention and their time to comforting their children if they are experiencing this. Now, children are very smart. They're very perceptive. They can tell if something is different or if something has changed. For example, perhaps you're having, as a parent who's working, perhaps you're having to work at home more and your child has noticed that. Or perhaps their school has closed and they've noticed that as well. So children are perceptive to these changes and will naturally ask questions. What we would do is encourage you as parents or caregivers of young people to be as honest as possible with them, because giving children clear messages about the situation in a way that's adapted for their age can help them to understand what's going on. So remember, again, the idea of facts minimizing fear applies to every part of the population, whether you're a young person or a parent. If you're in a situation where you're having to spend more time at home or your kids have had to come off school, we would encourage you to try to maintain as normal a routine as possible for that child. So helping them to retain onto some sort of normalcy. And if that's not possible, to create new routines, which include times for playing and times for learning, if that's possible. So there's a big role that caregivers can play in this. Again.
Great advice, Aisha. Going back to individuals, people who are facing discrimination, we get a question from Mehak Ayman. How can we provide support to these individuals who are facing discrimination because of this coronavirus?
Mehak, that's a really nice question. And I'm really glad you've asked that question because it really, for me, emphasizes that all of us have a role to play when it comes to supporting those who might be additionally affected by the current situation. So in this regard, I would say to make sure that you're providing as much kindness and compassion to that person as possible. You can use principles called psychological first aid principles, and that information is also available on our website, where you're giving practical but emotional support to that person if they need it. I also talked about before all the actions that you can take to help to tackle stigma. So around using certain types of language, and also around your role in correcting any misconceptions or misinformation or misuses of language out there. So that's another activity that you could do at the higher level. If you feel that your friend is really affected by this experience that they've had, if they've had direct discrimination, you can encourage your friend, if they need to reach out and seek social support from a trusted person. So that could be someone in their social circle, like yourself, or like another friend or a family member. If needed, it can also include seeking specialist support from mental health and psychosocial services if they're available in your area, if your friend's well-being really declines.
Good advice again. So with this coronavirus, some countries are asking people to do self-quarantine, or for visitor who just came to do, who just come into the country to be under quarantine. I get a question from Ramya Onatu. What kind of support we can give to reduce the anxiety for people who are on quarantine?
Yeah, really important question. Being in some form of isolation or quarantine is a challenging experience for your mental well-being. We advocate very heavily around social support being very good for your mental health. But the idea of isolation or quarantine means that that can be a little bit limited. That's not always the case. It could be that you're self-isolating at home, but you've still got other family members or friends in the house, or that you're in quarantine and that there are other people that might be accessible to you. If possible, keep maintaining your social contacts within reason, if in person, according to the health guidance of your country. Otherwise, if you have this accessible to you, digital methods of communication or even phone is a really good way to keep maintaining your social contact. And it's something in particular to think about with adolescents during this time. Now, when you're in isolation, another important thing to do is still to continue, if possible, maintaining your routines to maintain a sense of normality. And when I say maintaining routines, this is because it includes self-care strategies. So you're eating well, trying to make sure you get enough rest and sleep, and trying to get physical activity as well. So these are all things that you can do when you're in isolation. And also activities that stimulate your mind, or that are what we call cognitively stimulating, can be quite good as well. So number of different simple actions that you can take to help minimize stress during that time.
Thanks, Aisha. We talked earlier about children. Now we get a question from Andrea Quintal from Portugal, who asked how can she help her parents to cope with their anxiety about the coronavirus.
Oh, so is this Andrea asking as a child?
Yes, parents is 66 years old.
Okay. So really important question. So I see we were talking about children earlier. Now we're talking about actually our parents who might be older adult population. So older adults vary in many different ways. And what is important for older adults is ensuring that they have the facts and the information presented to them in a very clear way. So again, just reiterating that facts can help to minimize fear. And what can be helpful for older adults is to think about making sure that the information that they're receiving about how to protect themselves is clearly presented and is something that they're able to understand and implement for themselves. So this is a very simple action that can be taken. Similarly, all the advice about taking care of yourself, so the healthy diet, healthy sleeping, healthy exercise, or some form of physical activity can also be applied to older adults as well. So this can be among some of the things that you're recommending to your parents if they're in that population. Now, there are a variety of things that we also need to think about with the older adult population. Some people might have a cognitive decline or a dementia, and there we need to think a little bit more about how the messages are given to ensure that they're able to protect themselves. So you might need to make adaptations. You might find that you're needing to repeat, that you're presenting information more simply, using simple languages, or even presenting it using images or pictorially. This can be an important adaptation to make. And this is something that can be helpful to minimize the stress of older adults at that time.
Naila Abu Malham Dugani, I hope I read the name correctly, asked about what about healthcare providers who are taking patients with COVID-19? I mean, with the number of patients, I think they're also affected, and how can they take care of their mental health?
Yeah. That's a really excellent question, and I'm glad that you asked this. So healthcare workers or anyone that is responding at this moment in time in health facilities to COVID-19 are under a lot of pressure at the moment. They might be experiencing longer work hours, higher demands on them, many pressures. And on top of that, the fear around COVID as well, which affects all members of the public. And this can be detrimental to workers' mental health and their stress. And so it's important for people that are responding to recognize and be aware of the fact that it's very likely many of your colleagues feel the same way. And feeling stressed in this situation, a little bit like fear, can sometimes be helpful. It's probably keeping you motivated and active in your job. And it's important to think about managing your stress as well as protecting yourself physically during the COVID-19 response, because the better your mental well-being during this time, the better capacity you will have to be able to do your job. So it is important to think about stress management as well. So again, the same things apply to health workers in terms of looking after yourselves as it does for all members of the population. So your self-care strategies around seeking social support, looking after your health, your diet, your physical activity, and also thinking about what are the strategies that you might have used before to help you cope with stress. Many of you might not have experienced a situation like COVID-19 before. That's okay. The situation may be different, but the strategies for managing stress are the same. And it's really important as well for health workers to think about, and everyone to think about minimizing strategies which might not be very helpful for you. So these are things that feel really good in the short term, like having alcohol or having tobacco or drugs, but actually in the long term don't benefit your mental well-being. So many things that health workers can think about. But on top of that, we are talking about a workplace situation where health workers have managers or leaders of health facilities. So it's also important for managers to think about the idea that protecting their health workers from chronic stress will benefit that worker. Encouraging things such as taking breaks, so encouraging them and modeling them can be very helpful for your health worker population. Rotating workers from high stress to low stress functions, or pairing experienced workers with inexperienced workers or other forms of the buddy system can be really helpful. And just like everybody else, making sure that your team that are responding to COVID are kept up to date with the information. So that's all the members of your team. This can really help with managing stress at the time. And finally, that managers themselves are probably under undue pressure in this moment. So it's important for them to model self-care strategies so it benefits them and is a good representation to their workers.
Great. We're getting a lot of interesting questions. I think people are asking for a different group of the population.
Okay.
We have a question from Heather Dawson, who asks, so as a mental health practitioner, how do we control the anxiety of those who are most vulnerable? For example, the homeless, substance addicted, and severely mentally ill.
Yeah, really nice question, Heather, about how do we best support people who are currently experiencing mental health or substance use conditions, or who might be at risk of experiencing stress, such as the homeless population. I think at this time, it's very important to make sure that those people who are experiencing mental health and substance use conditions still have access to the treatment that they need, whether that's in-person a medical treatment or psychological treatment or medication treatment. That it's important that support is still in place during this time. And that's something really important to think about, particularly around where people might have to self-isolate. So, as I said earlier, a situation like this can really exacerbate the stress of the population and can really exacerbate stress or potentially lead to relapse for people who do have existing conditions. So it's important to ensure that care is still in place and that mental health practitioners or mental health and psychosocial support practitioners are well placed to provide this support. Many practitioners might not have had the experience of being in a public health emergency like this, and I would encourage them to get some training to make sure that they are having the capacity to respond to people at this time. So those are some of the messages to think about in this scenario.
Thanks, Aisha. There's also a question from Carlos Rivera Rosario. Thank you for your question. This is about employers. How can employers work with their employees for mental health in the workplace in relation to COVID-19?
Yeah, great question, Carlos. So again, what's important in the workplace is the role that employers can play in disseminating information that can help with various aspects of the response to COVID-19, whether that's information about how you protect yourself physically, so for example, the hand washing and so forth, but also how employees can be protected from their stress management as well. So previously, we've encouraged that employees have an active role in this, whether it's disseminating that information by email or having posters up. The same should be done for stress management as well. And on top of that, fundamentally, this is around your employees having access to factual, credible, up-to-date information. So encouraging accessing those resources is something that employers can do as well, because facts will help with answering the questions that your employees might have. And providing forums to have conversations, provide an opportunity for employees to ask questions can also be something that's very beneficial at this time to address the questions that your employees might be having that might be causing them some anxiety.
There's a question from Tenzin Chokra asking about what about meditation for those who are stressed with COVID-19?
Yeah.
Would that be helpful?
Really nice question. Something that we encourage is strategies that you have used in the past, which you have found to be helpful to you, which have helped you to relax or to minimize your stress or minimize anxiety, would really strongly encourage carrying on with those activities as long as they are helpful and safe for you. So meditation could be one of those activities. And there are many other activities that people might have found has been helpful in the past for them to manage stress and is something that they can implement now. So I think that's a very nice message and another example of positive actions that people can take, something that can be shared and encouraged in others.
Another interesting question from Juan Carlos Lopez in Madrid, I believe, who asked in relation of schools being closed, either because there is a confirmed COVID-19 patient or as a precautionary. His question is how to reduce fear about COVID-19 among students and possible bullying consequences for children who are infected with COVID-19. It's an interesting question.
Very interesting question, Juan. And I'm making the assumption that with the way that you've asked the question, that you're talking about a school that hasn't closed yet. So you're talking about situations where students, or maybe afterwards, so situations where there might be bullying. So really important point, and actually ties into it, what we've been talking about earlier in this conversation, which is around stigma. And stigma having an impact on the acts of discrimination that people can take. And bullying between young people is one of those examples. So if a school is still in session, this is an opportunity for schools to be able to disseminate the information which helps to tackle stigma. So these are the things we were talking about earlier around not attaching COVID-19 to any particular socio-demographic or nationality or geography, because by doing so, we can increase the likelihood of discrimination towards people who identify from those groups or who are perceived to be identifying from those groups. So that's one aspect of it. Now, if school's not in session, this is something that parents or caregivers of young people can address as well. So addressing how to manage the fear around COVID-19. So encouraging young people in a way that's adapted to that person's developmental ability and their understanding around what the facts are, how to protect yourself, and methods for managing well-being and stress. So, for example, maintaining your routines, maintaining a healthy lifestyle at home, and encouraging times for play and learning if that's possible. And additionally, social support as well. So keeping in as much contact with each other, if not in person, then digitally, if that's an option. If your child or if a person that you know has experienced bullying or continues to experience bullying in the community, and it's something that is causing them a lot of distress, because we know there's a link between bullying and mental health, then I would really encourage social support around that person, and for that person to seek further support through local services and local providers to help them manage the distress that they're experiencing.
Great. There's a question from Twitter about the news on coronavirus, because there's so many reporting about this coronavirus. And it affects people when they watch, when they hear. How to react to all this news around us?
Great question. There's so much information out there at the moment, and for some people, actually, it's quite normal to have so much information coming at us and be quite overwhelmed by it. And in fact, some people can find the news very distressing at this moment in time. So we would really encourage as well, as part of managing fear and stress in COVID-19, to minimize, if it's something that distresses you, to minimize the amount of times that you are exposing yourself to news or media. And you could even consider setting a target to limit yourself, for example, 1 to 2 times a day only. Something just to reflect on with the news as well is just to remember that the numbers and the information that's coming through, these are numbers, but we are talking about people and people's lives. So that is just something to reflect on when trying to think about how do we make sure that we have empathy and kindness as part of our response to COVID-19.
And a question from Jenny Chung about the panic buying. When people are buying toilet papers, pasta, canned food, why do people behave this way? And what should they do?
Okay. So I said earlier that fear is something that we're all designed to experience fear, because fear is something that can help to keep us safe. And fear is something that we experience in the face of perceived or actual danger, or where there's uncertainty, something unknown, something unclear. So fear can sometimes lead us to take actions which help to keep ourselves safe. And sometimes it can lead us to actions which might not be beneficial for us and might not be beneficial for others. So this is something that fear does. If we're experiencing a lot of fear and engaging in actions which perhaps aren't helpful or necessary for ourselves or indeed for the benefit of our communities, it's something that it makes sense in the context of the situation. But the advice around this is to think about what are the facts at the moment. What does the information say about what you need to do to protect yourself? And I think the advice is around making sure you have sufficient resources should you have to self-isolate, which is for a period of 14 days.
Here is an interesting question that probably some of us experience this day. It's from Twitter. My fear is about coughing in public. People look at you with suspicion. How can I approach or manage a situation like that?
That's a very interesting question as well. I think it's an anxiety that is indeed shared by many people. The important thing here is you don't necessarily need to take responsibility for managing other people's responses to you. I think ultimately, as long as you're following the protection procedures and the coughing etiquette, so on, that's been advocated by WHO, that's what's important in this situation. So other people, I hope you're aware of the advice that WHO has been issuing around how to protect yourself. For example, good coughing etiquette, but it's not something that we cannot always manage the response towards other people. But this is part of why addressing the stigma around COVID-19 is important. It is flu season at the moment. Many people do have coughs and sniffles.
And when we are talking about coughing etiquette, it means coughing to your elbow or cover it with tissue, and then after that, to throw it away immediately in a bin, a closed bin, right? So one last question is also from Twitter. So how can people be made aware not to fear stigma and to act logically? So it's not only for themselves, but also for others, so not affecting other mental health well-being.
Yeah,
it's a good closing question.
This is a great closing question. So overall, we're thinking about managing fear during COVID, but in turn also managing stigma. So first of all, it's very normal to be experiencing fear and stress during this time. Facts on how you protect yourself, how you can protect others, are the solution to any misinformation or rumors which can be part of perpetuating some of the stigma at this time. And self-care strategies are the way to address your mental health and your stress and manage your well-being at this time. And should you experience a deterioration, to make sure that you do go seek specialist support if needed. Minimizing the amount of time that you're exposed to news, if it is something that's distressing you, is important, but also to manage stigma, thinking about managing your language. So not using terms that attribute stigma onto a particular group of people, and also thinking about how to promote empathetic, positive messages around recovery, stories around people who've supported another person during this time. These can be helpful messages that all the community can participate in to help promote mental well-being and reduce stigma at this moment in time while we're all responding to COVID-19.
Thank you, Aisha, and thank you for everyone who have joined us this afternoon. We have people around the world joining our live from South Sudan, Myanmar, Italy, India, Malaysia, Philippines, Portugal, Thailand, Romania, Kazakhstan, Australia, Denmark, Singapore, Indonesia, Mongolia, Costa Rica, China, Austria, South Africa, Jamaica, Namibia, Uganda, Pakistan, Cambodia, and many more. So we are all in this together, and we all have a role to play, as Aisha said. So also as our Director General, Dr. Tedros said, it's solidarity and not stigma. For more information, you can go to our website, www.who.int/COVID-19. Thank you again, Aisha Malik, and I'm sorry, Satyogi. Thank you, and keep joining our live next time.
You hear me?
You're good. You're good now.
You did. I was like, okay. Okay, I stopped recording mine, but I can record again for another debrief.
Oh, that's good.
2 separate videos.
Yeah.
Sweet. How'd you feel?
I feel good. I feel like when I practiced, I was like farther behind. I was like right on her. So, which ended up being like more English. So if I would have like waited a little bit, I could have just like increased my processing time to like make it more visual. But in this situation, she talks about the same things. Like I only viewed your part like a little bit, but she repeats herself. Even like in the same questions that I had, she just repeats herself. It doesn't involve a lot of visual language. It's like facts and like mental health and what to do and like different approaches. So yeah.
No, I think what you did was all very appropriate.
Mm-hmm.
So, yeah, I don't know. I would think if like deaf people were watching this, it'd be like educated deaf adults, you know? So I feel like it was all appropriate.
Yeah. That's cool. That's a good idea.
Yeah.
Deaf adults, like as our consumer audience. Yeah. How do you feel about it?
I feel similar to about the processing time. I kept like, if this is the continuum of CI and SI, I kept going back and forth and I couldn't find like a sweet spot. Like at the beginning, I was like almost like 2 sentences behind her and I was struggling with my memory.
Mm-hmm.
And I was like, what did she say? What did she say? And I really had to pay attention. Yeah. And then I got closer and my processing got to more SI. And then I was like right on her. And I was like, this does not work. So I really had to manage that. And when I was trying to figure that out, I didn't always have the most effective choices in my language.
Mm-hmm.
I can't think of a specific one, but like some of them, after I signed it, I'd be like, that does not work. Why did you sign that?
Yeah.
So, but at least like this was low risk because I was able to identify it and not feel like totally bad about my choice and then fix it, which I did, which I thought was good.
Yeah, exactly. Like the biggest thing is that you're aware. So like, oh, that wasn't good. Now this is a learning opportunity to improve and to sneak it in there later if you knew it. Like it's different than when you review your work and you're like, oh crap, I signed that wrong. You can't really fix it. I mean, you can for the next time, but like the point that you like were aware of it in the moment and was able to add that back in, like that's awesome. I had like specific examples. Oh, the video was choppy, but it was, if I didn't look at it, it was fine. The voicing was fine. Just if I looked at it, it was like choppy and their like lips didn't match it, which is fine. So I just didn't look at the picture. And your video was a little bit choppy, so I almost stopped you, but then it got better. And so like I didn't need it to look at it, you know. So that was
that tells me I need to get an Ethernet cord. My internet.
I know.
I appreciate you for telling me that.
Yeah. What did I say? I don't know what else I said. I feel like I had a bunch in the moment, but yeah, I just, when I prepped, I like took notes and I'm like, oh, I'm gonna sign it this way. And then when it comes to the actual video, I'm like, oh, I gotta, but I think I kept almost the entire meaning and content. Like I don't think I omitted a lot. So that's good because I think I'm getting faster, but it's just still English. So I need to go back now and like slow it down and like think of how to make it visual and even not like visual in this situation if I could, yeah, but like grammar and of like ASL structure and grammar. Because that doesn't necessarily mean it has to be visual, you know, it just has to be the right order, which I think mine was like a lot of English in order, but there's a couple times that I think there was a lot of opportunity to set up like healthcare providers and then their bosses and managers and like protecting them or like, so I was able to set up a lot.
Yeah, you did that.
So that was good because there's so many related questions. Like I did a content map and like there was some because they talked about healthcare workers and managers, and then later they talked about employers and employees. So I hope I set those up on the same time because like that's like basically the same thing, you know. So
It's like basically the same thing.
It is.
You just said that really funny.
Yeah.
Yeah, I agree.
I know.
No, I thought your work was very effective.
Yeah.
Even if it was like, even if you do feel like it's a little English, I still think that's fine for the audience that would be watching.
That's true. Very true. Well, yeah, and I think you did amazing.
Oh, I think you did really good too.
There's some like signs that I wasn't sure of. Like I knew how I was going to sign them, but I didn't know that they're that prevalent in your part. So like general prop or like public, what was it? Public emergency, whatever. And so I think I did public different. So I'm like, oh, general public. So I copied that one. And then there's another one. The stigma, I think that was really nice. Like setting that up. But there's another one. Routine. Because I was gonna sign like happy life again, and you like did every day. And I remembered it and I used it in mine too. So I think that's good for like teaming to be like, of course, going over terms that we both like will come up in both of ours, but you never know because it's not always scripted. So like paying attention to how the first person signs them because you want to make it consistent. So
yeah, absolutely. I agree. There was something that came up towards the end, and I didn't watch all the way to the end.
Mm-hmm.
I watched probably like to 15, 16 minutes, and I was like, okay, this is fine.
Yeah.
But she said something, and I was like, wow, I'm really glad I have this in my vocabulary because I didn't have this on, I didn't prep it, and it just randomly came up.
Mm-hmm.
And it was, I don't remember what it is. I can go back and look at it, but I was like, oh my God. I'm really glad I have this sign in my vocabulary.
I highlighted like detrimental, like causing hurt, exacerbated, like increase or disseminating, like spreading.
Yeah, that one was good.
There's like a lot of
dementia. That's what it was. Dementia. Yeah. And I was like, oh my God, I'm so glad I have this in my vocabulary. Dementia.
I noticed that too because when I was prepping, I kind of like looked at your part too, just so I would know like and I'm like, I don't know that sign and I should have looked it up, but I saw you and I'm like, oh yeah.
Because it's like forget a lot.
Yeah.
So yeah.
That's good. Yeah.
Sorry. I just looked that up and I was like, that was a sign. I was really glad I had that sign in my vocab.
Yeah, definitely. Cool. Yeah, I think that was really good and I think it's definitely a portfolio evidence contender, especially like our before and after talking because
I know. I think we teamed well together too, which was nice. Yeah. So it wasn't like, and I kept like watching you too, and I could see when you're processing, and I was like, okay, she's processing, don't feed her. Yeah. So
I learned that too last time because Erin has like the best memory of anyone I've ever seen. So she was like 2 cents behind, and she still was remembering everything. So I'm like, should I feed her? But she had all the content. She was just like, but then she like caught up later. But I'm like, I can't like remember that much but I need to find an equal ground because I'm too far or too close up. But,
I struggle finding that like sweet spot in CI and SI and my lag time. I'm like the beginning, like I said, I was like 2 sentences behind, and then like 5 minutes of like trying to actively remember everything. I was like, oh, I gotta go up. I can't do it anymore. And I got too close, and it was like, this is not. It's hard.
I noticed when you're like farther back, and I was like, wow, like you still have it all, and I'm like, that's awesome. But
it's hard.
The other thing is like your role shifting. I think that was like really clear because I didn't practice that in my preparation, but I saw you do it, so I kind of try to do the same side. But I think that was good, and I think it was nice to have like the couple second downtime when she was asking the question. I'm like, that was nice just to like, okay, it's a clear transition, and you're able to like listen to the question first.
Yeah, I like this video. This one was a good one.
I I did too. It was like not over an hour long, and it was interesting information.
Yeah.
And I really like both of them. They were really. Oh, I did put a demand. Just when I do my prep or my journal, like the accents. I can't remember what word. Oh, like medication and meditation. Because I always want to do that, and I'm like, no, it's meditation. And then there was a couple other ones where I couldn't understand. I'm sorry, her name.
I noticed that when you like would switch meditation,
Yes.
and I was like, I don't know either.
No, but I knew it was meditation. But every time I was practicing, I would do medication. So I did meditation, and then I'm like, oh yeah, meditation. And like I try to get it right because
fine.
Yeah. But
all right,
cool.
Do you want to say anything else before I end the recording for the debrief?
I don't think so.
Okay. Cool. There we go.
Oh, I have actually a question. I'm gonna stop mine too.
Okay.
Not related to that. The
okay.
The A work today, I like finally Madison had track and I like just got home a little bit ago. So I haven't started today. But isn't that the same thing that we did like in week 2 and we couldn't find the right one? But
she posted in homeroom. She said if the links are repeated or if they're broken, we can find our own videos.
Awesome.
So Ryan and I were in a group last week with Molly. And then like at the end of that meeting we were like, let's find another thing to team together.
Yeah.
Because it was like really fun. And because we were doing like the wolf thing, whatever that Summit, Colorado. So Ryan messaged me and Molly and was like, so this link is broken. Do you guys want to team a video? And we were like, sure. And he picked a court interpretation. And I'm like, oh my God, this is hard. This is hard.
I'm so excited to pick one out. Like, I'm so excited. I'm like, I don't know what to do because there's so many ideas. Like, I feel like she should do that, like, at least one A work a week. Yeah. Because then we can find something that we have schema for and that we're interested in. Because I've noticed on the daily moss, when it's always negative or like something about a different country, I don't do as well. But if it's something that I'm interested in and if it's something positive, then I'm like, do so much better.
Same. So, I wrote in a journal, and I'm surprised she didn't comment on this, but I had said, I'm really out of touch with international news. But that's because in my local news, a girl just got murdered. And that's terrible. But I was so out of touch with all of that war in Palestine and
that they talked about every day.
I was like, I don't even know what's happening, but I know what's happening right here in Jacksonville, Florida. Yeah. I got that. I could just be fine. But I wrote that in my journal too, that I struggled with international news because I'm like,
I know. I know.
Yeah.
I had to like look it up on like the news, like right in to like find out what it is. Because I hated every time he talked about that. I'm like, thank God that story is over.
Yay, 11 days later.
I know. But all right, awesome. Thank you so much. This was really fun. I love reading and
I know. Let me know if you want to randomly do another teamwork that is like, like a really long video and you're like, I don't want to do this. Let me know.
There's definitely going to be some before we end, so cool.
Alrighty, lady. Have a nice evening.
All right,
we'll see you later. Bye.